आफ्टर 1 year of stroke, can recovery still happen? Stroke के 1 साल के बाद क्या recovery possible है?
नहीं।
But today let's see what the science actually says, because something this belief alone stop progress. So the common belief is most stroke patient hear these, the maximum recovery happens 3 to 6 months. And yes, early recovery usually fast recovery does not mean the final recovery. The brain does not suddenly stop healing after 6 months or 1 year. यह एक common myth है. Through this video, we will try to understand that why early recovery is fast. Research identify the three main scientific reasons why recovery is faster in the first 90 days following a stroke. So this golden window or sensitive period, because the brain is biological primed for repair. The first phase, wake up phase, spontaneous biological recovery phase. So what happened the first few weeks after stroke? The brain swelling or cerebral edema reduces, blood flow returns to the penumbra. The penumbra, the stunned but alive brain area. So these neurons are not dead, they are just switch off. When swelling reduces and circulation improves, they suddenly wake up. And the result, you see the rapid improvement. Hand start moving, speech become clear, and balance improves. So this is called spontaneous recovery phase. So according to the evidence, neuroimaging studies published in journals like the Lancet Neurology, functional recovery correlates with perfusions of the neural tissues. The second phase, the hyperplastic state, peak neuroplasticity state. This is the most important part. For around 3 months, the brain enter a sensitive learning window. So what happened? The brain release a growth factor like BDNF, brain drive neurotropic factor. So think BDNF as a brain fertilizer. It helps to form a new synapses, strengthen the neural connections, build a new motor pathways. So evidence research published in the Nature Reviews Neurology explain that the early post-stroke period shows enhanced neuroplasticity, similar to the developmental brain plasticity. So the result, rewiring is easier, therapy works faster, motor learning is stronger after 6 months. So plasticity is reduces, but it never becomes zero after 6 months. The third phase, use it or lose it window. So this is the silent enemy. If the patient stop using the weak hand early, the brain says, okay, no need, delete this map. So motor cortex representation sinks. So this phenomena was strongly demonstrated by the constant induced movement research led by the Edward Top. So what happens if the limb is not used? Cortical map shrinks, neural connections weaken, and recovery will be slow. So clot versus bleed. Does the type of stroke matter? Yes. Clot ischemic usually see a fast start. Bleeds hemorrhagic often start slow because they have a mass to clear up first, but they often have a strong finish, the greater long-term result. So no matter time, 90 days are the bigger opportunity. But the big question is, after 1 year of stroke, can recovery still happen? So what research shows? Rehabilitation studies over many years show something very clear. Of Neurophysiology 2019 paper, title of research, a critical time window for recovery extend beyond 1 year post-stroke. The type of study is a longitudinal cohort study. There was 219 stroke patients, and the key finding is significant motor improvement was still seen well beyond 12 months with intensive therapy. So important point, recovery is dose dependent even in the chronic stage. Journal of Frontiers in Neurology 2017 paper, title of research, spasticity, motor recovery and neural plasticity after stroke. The type of study is a systemic review and meta-analysis. The key finding, neuroplasticity remains active for years after stroke, not just first 3 months. The important point, constant induced movement therapy, CIMT, and robotics produce measurable brain changes even 5 to 10 years post-stroke. Journal of Disability and Rehabilitation paper, the title, Recovery After Stroke, a 1 year profile. The type of study, longitudinal study, the key finding, motor functions and social participation improved between 6 to 12 months post-stroke. Important conclusion, late recovery is real and has strong implications for long-term rehabilitation planning. Journal of Annals of Clinical and Translational Neurology 2025 research paper. Title of research: Long-term temporal profile of motor recovery after intracerebral hemorrhage. The type of study: multi-centered cohort study. Key finding: motor recovery continue beyond 1 year up to 44 months in same patient. Clinical Translation 2025 paper. The title of research: Stroke Recovery Program Incorporating Moderate Intensity Aerobic Exercise. The type of study: prospective type, a 1 year follow-up. Key finding: structured aerobic based rehabilitation produced significant functional gain that were still measurable at 12 months. So even in the chronic stage, meaning after 1 year, patient can still improve. How? Because of the neuroplasticity means the brain can reorganize itself, it can form new connections. Healthy area can support damaged area. और यह एबिलिटी 1 साल बाद खत्म नहीं होती. So what kind of therapy works late? Study using task specific training, intensive repetition, gait training, constant induced movement therapy, aerobic exercise program has shown measurable improvements even year later. Recovery may be slower, but biological possible है. So why many patients stop improving? Many patients stop improving after some time, usually because therapy intensity decrease, exercise become routine, no progressions, regular follow-up. The brain changes only when challenged. No challenge, no adaptation. So neuroplasticity is use dependent. अगर ब्रेन को पुश नहीं करेंगे तो अडाप्टेशन. What actually drives late recovery? If someone in 1 year after stroke, improvement depends on repetitions, 100 of repetition, not just 10 or 15. Task specific training, real life activities. Exercise must become harder. Active participation, passive movement alone is not enough. Consistency, regular therapy matter. Let's be realistic. Late recovery does not mean even full recovers. Severe paralysis, full reserves. Severity and the lesion and location also matter. But saying nothing improves after 1 year is scientifically incorrect. The brain does not follow a calendar, it responds to a stimulus. So, the final answer: so can stroke recover continue after 1 year? The honest scientific answer is yes. Improvement is possible, but it requires effort, intensity, and structured rehabilitation. Recovery may slow down, but it does not suddenly stop. So in the next video, I will explain what really happens inside the brain after stroke. So this will completely change how you see the stroke rehabilitation. So now tell me in the comment, should therapy automatically stop after 6 months? Yes or no?